Welcome to the show this morning. The topic this morning is the American Diabetes Association, and we're fortunate to have with us two persons to talk about diabetes. Ms. JSmith. Ms. Smith is the director of the Diabetes Center at Baptist Hospital, and Ms. Smith, let us welcome you to the show this morning. And of course, with Ms. Smith is Ms. DBoran. Ms. DBoran is a worker for First American Bank. I think, Ms. Boran, you're also a specialist at First American Bank. And let me welcome both of you to the show this morning to give us some information about the American Diabetes Association. Ms. Smith, before we get started in that area, let's have you give us some information about your background and your education and some of the things that were important in leading you to the director of the Diabetes Center at Baptist Hospital, after which Ms. Boran will give us the same kind of information relative to her background and her education. Let's start off with you, Ms. Smith.
Okay. Well, thank you, Dr. Haney. It's a pleasure to be here this morning. I've been in healthcare for approximately 20 years now. I started off as a critical care nurse. Unfortunately, as a critical care nurse, I saw patients after they'd had their complications with diabetes. It was after they had had diabetes for a period of time and had suffered the complications that we've all become aware of for long-term illness. I have a master's from Vanderbilt in human resource development and organizational development. That led me to have a keen interest in adult education. Before coming to Baptist, I was with the University of Tennessee's critical care program doing education in that respect, teaching professionals. Baptist opened the Baptist Diabetes Center in November of '94. At that time, we were looking at a brand new facility, launching a whole new program for Baptist. This was something that heretofore had not been a focus. It was immediately apparent that there was a wonderful market out there, a market that needed to be tapped for diabetes education. Baptist has a history in Nashville of approximately 75 years of being a nonprofit organization that does a great deal of community service and education. This was just another opportunity for us to serve the people of Middle Tennessee. I consider myself fortunate, number one, to be associated with Baptist, and number two, to have an affiliation with American Diabetes Association for the people of Middle Tennessee and the physicians, not necessarily just patients that have diabetes, but also those physicians that deal with those patients on a daily basis.
Very good. We want you to talk about the American Diabetes Association later on, Ms. Smith. Ms. Boran, let's look at your background and your education and some of the things that were important that got you involved in diabetes education.
Okay, well, that's fine. I don't think I've got quite the biography. But really, the way I became involved with the American Diabetes Association, I've been involved since I was 3 1/2 when I was diagnosed with diabetes. And over the course of growing up, I participated in the fundraisers. I remember riding in my first bike ride and raising my money when I was 7 years old, and went to the camps, which I found very soon are the only opportunities for some of these children to know that they are normal and can be normal. And in many cases, the only place that they get their first education. I went to college in South Carolina, and I've been working at First American since I graduated. Been there for 8 years. You can put the years together. As a matter of fact, I had my 8th anniversary yesterday, but I started with them in Memphis and then worked in the branch system there, and now I'm working as a bank at work specialist, which means that I help implement banking benefit packages for the employees of our corporate customers.
Very good.
Yeah.
Ms. Smith, let's look at diabetes. I think it's one of those hidden kind of diseases, and there's quite a bit of hidden information in reference to it. Let's have you to, first of all, give us some information relative to the American Diabetes Association, and then let's talk about some of the issues that are involved in diabetes education. Let's look at it from that perspective.
The American Diabetes Association is that association specifically interested in research and education for those people with diabetes. Unfortunately, we don't know as much about diabetes as we'd like. There's a lot of research yet to be done. There's a lot of research that has been done, and because of the fundraisers the American Diabetes Association sponsors, we've been able to contribute to that a great deal. Also, when we look at education, most people look to a specialty organization for whatever education they want in that particular disease process. American Diabetes Association is a wonderful resource for education, not only for patients, but then again for healthcare professionals and the general public. There are a wealth of programs available. Patients can call an 800 number, get information. They can get printed information. They can call and ask general questions and get answers to these, get some direction for support groups. Most people with a chronic disease need that additional support. Family members are very loving and caring, but also that support from an outside resource is just invaluable. I think Dudley can address the ADA as well.
Oh, absolutely, because I would add to that that among the programs that are being offered, there are support groups for the families as well, because you know, until there's a cure, the motto is until there's a cure, there's American Diabetes Association. And not only when I was growing up did I need support, which I received from support groups in the camps, but some, you know, the families need support. They say, am I going it alone? A lot of them blame themselves for why their child has it. So those are just as important to me as far as that's concerned. But there is such a wealth out there. For instance, we conduct what we call unmeetings. They're held in each part of the state at a different part of the year, and they are for youth and teenagers. And they meet with individuals who have diabetes and educators, and the parents are in another room.
Good.
Okay? So they are discussing issues at the same time. So they can, children, teenagers can feel free to get things out on the table, but sometimes they're like, how do I deal with dating and I'm at a party and drinking and things like that, and you always don't feel free to ask that of your parents. So that's just one example. The camps, they are nationwide. There's even a scuba camp in the islands, but with supervision, medical supervision, these camps meet every summer. There's a long list of them. But for a lot of these children, as I said, they can go and feel normal, ride horses and ride in a canoe and go camping overnight. And in many cases, it's the only time that they have contact with other individuals with diabetes, which I think is very important. I still keep in touch with some of the folks that I went to camp with. There are leadership conferences in Washington once a year for teenagers, and it's all sponsored by the American Diabetes Association. They can go to the Hill and meet with their congressperson and express, these are the issues that are important right now. We have government relations committees. I believe they just reversed, they grounded all pilots with insulin-dependent diabetes, and they've just reversed that. So again, it's a combination of